So our next speaker is Ms. Shahina Siddiqui. Ms. Siddiqui is the founder of the Executive Director of the Islamic Social Services Association based in Winnipeg and the chair of Islamic History Month, Canada. Shahina is active in the community and member of the RCMB Commissioner's National Advisory Committee on Diversity, as well as the RCMB Commanding Officer Diversity Committee. She has served with several NGOs and community organizations in Winnipeg. In addition to her work with various organizations, Shahina contributes as a freelance writer, spiritual counselor, and public speaker. Thank you for joining us today.
How do these things work? I'm a grandmother, tell me. Just press this?
So you just need this.
Okay, like that.
So just click.
Okay. Okay, first of all, let me greet you all with the greeting of Islam. Assalamu alaikum, peace be with all of you. I was just asking our respected speakers so far, why am I here? Because alhamdulillah, they have covered everything and they are scholars. I'm just a volunteer. Even at social services, I work as a volunteer executive director. My introduction into this was very personal. My son was born with a very rare condition, and the doctors told me he would perhaps live 6 months. He lived on for 5 more. His condition was not diagnosed till he was 5 years old. And my whole experience through that, plus with my parents, who are also in Winnipeg, and a lot of other families, and one thing that I noticed is that we were not prepared as a community, as you've heard, to pay attention to this area, which is very important. I usually do a day's workshop with healthcare workers on this. I'm crunching it now. I'll be slipping on slides, passing them by. But I wanted you to know something about Canadian Muslims. There are 1.6 billion Muslims in the world. In Canada, about 1.2 million. And they are coming from 56 different cultures. This is important to know when we are talking about diversity considerations. The other is that the religion diversity from conservative to liberal and every hue in the middle, okay? We speak many languages. In Winnipeg alone, in our center, we speak 35 to 40 different languages and dialects. So even communication between Muslim communities everywhere in Canada is English, and our language of worship, of course, is Arabic. So that is also important to know. And 2 major denominations, Shia and Sunni, and under them, lots of other variety as well. I wanted to talk something about a few concepts that our organization does workshops on. As we talk about cultural... There we go, cultural shock. Okay. Is that we have, because we call ourselves a multicultural society, but very few of us really understand what multiculturalism is and how culture impacts our decisions that we make in life, the way we relate to each other, the way we look at life and death. Even though we are all Muslims, we do have an influence from our cultures. And those could be family cultures, those could be lived and experienced cultures. So cultural competence is an ethical responsibility for all of people who are providing services, whether it is to patients or so forth. Okay. I hear this word cultural sensitivity and I cringe. And I'll tell you why. Because our governments for the longest time referred to for 5 minutes of presentation on a panel, and now we are all culturally sensitive. And the other thing that bothers me about this term is you can be a sensitive racist, okay? So I prefer cultural literacy. And I'll tell you the difference. Cultural sensitivity refers to or talks about the what I'm wearing, what I'm eating. Cultural literacy goes beyond the what to the why. And that is when relationships are built, that is where understanding happens, and you are open to learning, right? Otherwise, you are just looking at me, not really knowing me or understanding me. Spiritually, yes, be sensitive. Like we were today, provide a place for prayer, make sure the food was halal, and I'm sure you all know that halal meat tastes better. Okay, just my personal bias, okay? And that it is a multicultural community, and it is a faith-based community. So what is cultural competency? And I'm going to run through these because, as I said, it's a day-long thing. It refers to the ability to honor and respect the beliefs, language, interpersonal styles, and behaviors of individuals and families. And in our work in palliative care, I was part of the Palliative Care Manitoba Board and still work in that area, is that we are not working with a patient. We are working with a family. We are working with a unit. And even the team providing the services is not person, it's a team, right? So we need to make sure that that's the case. Another concept that we don't usually talk about is cultural safety. And what is it? It's for you to recognize that there is a power imbalance. In your case, it could be working with newcomers who have a language barrier, right? You could be working because you have the power and the patient and the client perceives it. Do they have a say? So there is a power imbalance, and it's always important at first interaction that you put that to rest. Institutional discrimination, ask any indigenous person, they will tell you in healthcare there is a huge institutional discrimination. And colonization and the relationship with colonizers. Almost all Muslim countries, with the exception of one or two, were colonized. And we come from that colonized experience, and so how we view authority is very different. Cultural humility is another. And I talk to Muslim communities when I'm training imams in cultural competency because we ourselves are multicultural, right? So we do have privilege. We have the Arab privilege in our communities, right? We have this idea that if you are speaking Arabic, somehow you are a better Muslim or you know more. And we have to work with that. Awareness of the dynamics of ever-changing. Culture is never static. Right? It's always changing, it's always evolving. So we have to be aware of that. And the practice cultural humility. Again, culture does not determine behavior, right? But rather affords group a repertoire of ideas. And if you are a good, well-practicing provider, you know how to do that. You know how to make that happen. Cultural responsiveness is another concept under cultural competency, and takes a person's culture and help that person infuse it into another culture, making it uniquely one. And that is what integration process is, okay? So what are the diversity considerations that I want you to be aware of? And you are all professionals. Be careful not to base assessment and intervention on stereotype and personal bias. I remember going to the hospital with my hijab, and the intake person would be talking to my husband as if I couldn't hear them. Okay, or I couldn't understand English. And my husband said, sorry, speak to her. I can't answer for her. Be aware of the interconnection between diversity dimensions because there are so many and they are also connect. Expect varying levels within one family. As a spiritual counselor, and I'm called into hospitals continuously because we don't have a Muslim chaplain in Manitoba. And so you can imagine my workload. But this is, again, you have to know, okay, I'm doing spiritual counseling, but at what level of spirituality are they? How practicing, not practicing, and so forth. How does this impact the family dynamics when they're making serious decisions about life and death and about advanced care or whatever? How do you speak to them? Acknowledge trust issues impacting Muslims. You talked about racism, Islamophobia, and that trust is also being impacted and on how they view service providers. I have been called into situations where I got a call from a mother. The son was had stopped taking his medicines. He was bipolar and was just screaming his head off and you know, bin Laden, this and that. And I said, take him to emergency call because he could be harmful to himself and his mother. And she said, I can't because of the things he's saying. CSIS will come and take him. I had to arrange for a Muslim doctor to meet them at the hospital so that she could be assured that ceases would not be called, because of course he was in a manic state. So those are the kinds of things, the way they are actually. And again, as I said, it is, I will not go through it, but for you to know what impacts our attitudes and how our core values work. So what is the concept of health? I'm really doing very basic practical stuff here for you. The concept of health in Muslims is, first of all, we believe that the body is given to us in trust from Allah. And there's a difference when you think about a gift and a trust. Life is not a gift, it's a trust. Gift can be exchanged, gift can be passed down, gift can be put in the closet and forget about it. Trust is that we have to return this trust to Allah in the best possible way. We have to take care of it. So they must seek medical help, take medications as prescribed, abstain from all that is contributing to health, and live a healthy lifestyle. I was just telling my friends on the table, the Prophet said, 1/3 for food, 1/3 for air, 1/3 for water. What is that? It's a perfect prescription for keeping your weight under control. Okay. Concept of suffering. The scholars have said so much about it. I just took a verse from the Quran, and it is on our brochures. If you have got the brochures, it is there. And this has what has helped me so many times in counseling. I was sitting with a wife whose husband had committed suicide by fire. He was literally just surviving on supports, and the doctors were telling, please, she has to let us take it away, and she was not ready because it was such a shock. She had 5 children, and this man had done it in his front yard, poured gasoline and burned himself. We know from his medical history that he was depressed. And I started reciting this verse with this woman, Inna lillahi wa inna ilaihi raji'un. And I just kept repeating, and she kept repeating after me. 1 hour of constant repetition. From Allah we come, and to Allah is our return. He is going home. You will see him. We will all die. We will all see each other again, inshallah. She was able to make that decision and say, okay, I'm ready. Concept of suffering caused by illness. We don't see illness as a wrath of God or a punishment. We see it as a normal consequence of living. And we actually believe that when you're ill, you're raised to a higher level and you're closer to Allah subhanahu wa ta'ala. There's a tradition, I don't know if it's in the other Muslim countries, but in my country, we go to the ill person to make dua for us, right? Dua means supplication. And that's why the busloads of Muslims, okay? We are all trying to get them to pray for us. The sick are actually given dispensation from religious obligations. Amazing, isn't it? We don't stand there with a stick and say, did you do your 5 daily prayers? Amen, they are nice to you, they give them a break. Okay, the sick, and then Islamic law, according to the severity of the illness. Rights of patients decide on medical treatment. This is something, because we're talking about gender as well, we will touch on this. Please know that the decision for the medical treatment, yes, it is done in consultation with the family, but both men and women who are not minors would make their own decision. So give that human dignity that you talk about, which is basically human rights, right? Give them that. Access to food and water and pain management, medication, but we have heard a lot, and I would defer to that. One should not refuse treatment that would restore health. That's the common advice that we give. When a treatment is futile, it ceases to be mandatory, right? Again, with the discussion and conversation, you've heard that. Suicide or euthanasia, both passive and active, are forbidden in general, but there's a lot of conversation now among scholars about what does that mean, and you have heard from the experts here. What is the attitude of a Muslim patient? For me, I always approach these situations as a counselor, so I need to mediate. I need to give them relief from the situation. So I always turn to the Quran. Okay, so how would I see it? And Muslims tend to accept an unfavorable outcome of medical intervention because they believe that only Allah determines. You know, we have a cliche in our Western societies when the doctor comes, well, we've tried everything now, It's up to God, right? Well, and I just turn around and I tell them, it was always in God's hands. You guys are just instruments, right? So again, you look at the verse and it tells you that we believe that the time of death is written. It cannot be moved forward or moved back. Again, Muslims believe Allah has reason for all circumstances. So when I'm counseling people who have to make decisions or who are suffering, I don't know why, because the question is always asked, why me? I asked myself when my son died, why me? But then the answer is in the Quran, well, just because you say you believe, you will not be tried. We all will be tried in some way or the other. And that, I have always seen that helping the family and the patient themselves, giving in to God's will. Muslims believe physicians, as I said, are merely instruments. Okay? And it is not given to a soul that they can die before their time is written. This is extremely empowering in grief counseling that we do. Because the question is also, for example, for me it was, why did my son, why didn't I take him to the hospital earlier? They had told me that he should be there. Could I have? And the reminder was, no, the time of death was written, right? That's the consolation. Spiritual care for the patients, I would say facilitate medical help, because doctors sometimes are so busy or they use such medical language, sorry, all the doctors sitting here, but you need a mediator who would put it in terms that the patient understands, right? Provide companionship. There is nothing worse than dying alone. I can tell you that. And this is across culture, this is across faiths. So a companionship should be provided. In the 70s, when I came to Canada, it was such strict rules. They wouldn't allow. Now it's easing up because the research has shown us that it helps. Inspire hope. A lot of people. There is a story of one of the Khalifa Harun, I think, yes, that he had appointed companions of the patients. And their job was, within the earshot of the patient, they would say, have you heard the doctors talking about how well he's doing, how well she's doing, and that they are improving, just to give that hope and that positive state of mind. Because it won't change the time of death, but it makes it hopeful. Again, recitation of the Quran is extremely important. I remember being in ICU and my son reciting for my husband, and we would have a lineup of nurses outside the door listening in. And they said, we wait every night before you guys leave because your son would recite, and it gives us all calm. These were not Muslim nurses. So you have to know that the power of the Quran that has in our lives. Again, at spiritual strengths, this is what I want you to draw on. Don't look at what is wrong with them in palliative care. See the strengths that they have. And some of the strengths alone are here. They believe that nothing happens, faith in the absolute power and the mercy of the Creator. So I am saying Allah is forgiving. Ask forgiveness, Allah will forgive you. There's nothing that cannot be forgiven if you do tawbah, if you ask for forgiveness. This is not a punishment and does not view. And again, I'm going to skip some of these because these are very practical things that I do with nurses and takers, but I want to get to what was the crux of, oh no, I should go back. I don't know how to go back. How to go back? Yeah, the first one? Okay. So, yes, there are modesty considerations for men too, people, and Ahmed reminded me that I should have a slide on that. Will prefer male nurses for personal hygiene or being lifted, etc. They would prefer to wear home clothes in palliative care or even in the hospital if possible. So I don't know who designed I call them aprons, they hardly cover anything, but anyway. And of course, some may not shake hands with women. Take cue from the patient if they offer their hand, take it. If not, leave it, May want to be dry and in a state of purity for prayers. I give you an example. I was called into a nursing home. The mother was in hospice, and there was war. And the family was saying, they are putting our mother on OCD medication and there are side effects. And so I go and I said, so this whole table, doctors and nurses on one side, the family on one side. I said, so what's the problem? Well, she's always getting agitated. She wants to be changed and she wants to, And I said, is it at particular times of the day? She said, yeah. And I said, so I'm OCD too. Because 5 daily prayers she wanted to be washed. So she could only do with her, and she would get agitated because they didn't understand what they were doing. The nurses told the doctors, I think she's OCD. A little intervention there helped with this family. Muslim patients become agitated if their clothing has become soiled because they want to be in a state of purity. So if you know that and you see they are agitated at certain times, help. Please attend to it as fast as you can because this emotional and physical distress is connected to spiritual distress and it doesn't help. Dry ablution is allowed. So yes, if they are dressing and stuff, they can do that. Exceptions can be made for chronic bladder issues and for the use of diapers. Okay? Diet. You all know that, and it's in our brochures as well. Visitors, another thing. Thank you. Visitors is, busloads of people do come, but if you have a kind, nice sign saying that, sorry, no visitors, because what I have found is when there are too many visitors, there are too many advisors as well. And that can make your job extremely difficult. So don't feel shy about saying, and the thing with our community is everybody is a brother and a sister. So when my husband was in the hospital, the receptionist said, how many brothers do you have? Like there were 100 visitors in a day, and I said, cut it out. You don't need to, I'm giving you permission. If an imam is a male and the patient is a female, please make sure that a family member of the woman is there because they will not be comfortable to see a male. What are the modesty considerations? Do not assume that modesty requirement based on whether the Muslim patient wears a hijab or not. Even Muslim women who don't wear a hijab will still want to maintain that modesty. Okay, which means they should be covered at all times. Women who do not wear the hijab will still appreciate the observance of the following concerns. Do not assume that an adult Muslim woman of clarity of mind cannot make decisions for herself. So don't wait for the husband to be there unless she asks, but you can talk to her. Consider the language barriers, please. There was research in UK that more Muslims were being admitted for psychiatric observance, and they thought, why? They're coming in for other issues, because the way we describe our suffering or our pain is my heart hurts. That's a spiritual expression, and they were being given all kind of EKGs and whatnot, and nothing was showing up, so, well, okay, maybe it's a psychiatric issue. So know that it's not just English and Arabic or Urdu, it's also about the connotation of those words and what's behind it. So if you have any issue, call up your cultural advisor. Women patients should be allowed to wear her home clothes during her hospital stay unless they interfere with the medical treatment. In this case, hospital pajamas and house gowns should be provided. Many Muslim women do not shake hands with men, and they are not who they are not related to. Adult Muslim women are free to make choices, as I said. An unmarried adult woman may defer decisions to their parents, but not always. So don't just assume that. Muslim women are not required to take their husband's name. It should not be assumed that they are common law, okay? Caring for Muslim patients must have access to family members and friends. You know, when you are giving, for example, a sponge bath to a patient, please don't send a male to a Muslim. I don't think any woman would be comfortable with it, but I just want to emphasize that it will not work with Muslim women too. If they are in palliative care, especially because there is a big power imbalance and they are feeling like they are dependent. When you feel you are dependent, you don't feel you can articulate what you want, because what if it backfires? What if they get upset? What if they, and there are a lot of questions that go through. Social etiquettes, do not raise your voice. We are advised by our Prophet that when you're visiting the ill, don't raise your voice. So sometimes some doctors, I have noticed and I have witnessed it, or healthcare providers raise their voices because the person has asked too many questions, or the person they think is not listening. Please don't raise your voices. That's not good etiquette. Music is not, in the palliative care, I know there's a lot of research about music and using music for healing, or don't do that for Muslims unless they have asked you or they are okay with it. Because for many Muslims, music is a no-no. The best music you can do for them is the recitation of the Quran, okay? And so have tapes that they can. Again, I want to share one example, and then I'll end and we can have questions. You know, this assumption that we make. I was called into a hospital in a crisis. The man had put on his form that he wanted to be buried as a Muslim. His wife was not Muslim. And so she was fighting with the nurses that, no, don't call the Muslim. And he was near death, and he had been there for a while. So they called me and they said, Mrs. Siddiqui, can you please come in? There's a lot of tension here. So I got there. The children were on this side and the wife, and she had to be convinced to let me see him. So I go to him and I see, of course, he's totally gone, and I start reciting the Declaration of Faith, right? And I'm holding his hand. The children are sitting on the other side. And then they look at me, what's going on? And his finger kept rising, the side that the children were in, as I was reciting the Shahada. And I just looked at them and I said, please leave it. And after I had done the prayers and I left, within a few minutes, he had passed away. The funeral time came, and we were going to give him a Muslim funeral. Some in the community were furious. Oh, he never lived any Muslim life. We didn't even know he was Muslim. He was drinking, he was this, and he was that. We don't want to do a Muslim funeral. And I said, who has that right to say that? I witnessed this man at the time of death raised his, because this is what we raise in our prayers when we say the Declaration of Faith. He was in coma, according to the doctors, but he did that on listening the Shahada. So never give up on anybody's religiosity or their spirituality or their commitment to the Creator. Ask if they want to talk. Ask what can I do, whom I can call. Read Quran and encourage patients to recite the Declaration of Faith only if they can. Speak gently, slowly, and softly. Ask about family and friends. If the family of the patient is overseas, this is a case for many Muslims. Please remember that. Help them write a long-distance call. Help them write a letter, record a message, and I've done all this for our patients in Manitoba. Pictures and posters of Islamic shrines. I can tell you I was in a situation called in by spiritual care at a hospital where the mother was refusing to give her stillbirth child, but they took him and she was going crazy. And so they called me and they said, please, I think she's not accepting the death. And I went and I talked to her and she kept pointing to the wall. And I said, huh? And I looked at it, there was a crucifix. And it dawned on me at that time, having gone to a Roman Catholic convent, I said, oh my God. So I sat down with her and I said, I'll make sure that they bring the baby and that you're able to say your goodbyes, but the baby is dead. Do you know in colonized countries, when there were missionary hospitals, the rumors were that they take the Muslim child, they say it's dead, but then they give it to Christian families. And she was coming from one of those areas, which I was able to then mediate between them. Again, there's a discussion for scholars. I only can go by what they have decided so far. If they have more to say, please do. And again, the dua that you had, which was actually made by Prophet Jesus. And so after hardship committees, Yusra, Yusra, this is the most beautiful, soothing verse that you can work with when you are spiritually counseling. And organ donation, of course, is allowed, but my experience with that was very negative. My son hadn't even died, and the neurologist came and said, we want to take his brain for research. And I just looked at him and I lost it, and I said, get out of here. And my pediatrician came and apologized. But I think after, it was such a rare disease, children don't live to the age that my son did, that it could have done some good, right? If I was asked and approached properly, but not in that harsh manner. But we cannot do it for commercial gains. Okay? So I ran through it as fast as I could. Thank you. Do we have time for questions? It better be an easy one, huh? Okay.
No, I thank you. You went through a lot of very practical material and things that I found useful. I think I can implement some of them in my own practice. My question to you is, and I don't want to sound negative, but this issue of cultural awareness, cultural sensitivity, cultural competence, whatever we call it, there's a tension in my mind that as a clinician, there's an awful lot I need to learn. And there's a lot of competing demands on my time. If there are, in Winnipeg alone, 40 cultural groups within Islam, within your Muslim community, and you expect the clinicians to be culturally aware, competent, whatever terminology you want to use for those. And then in other communities, there's so many more. There's an opportunity cost there because something else will have to go. And is it really reasonable to expect us to have that cultural competency with these nuances and with all the different groups that we have to look after? And what are we going to give up to be able to learn that? Because it doesn't come without a cost. Now, I don't want to say it's not important, but there are many other things that are also important. And I think we sometimes are too glib in saying, oh, it's a right and we have to. And it's like, well, really? And where's the cost?
Yeah, no, that's a very good question. Do you know at the bottom line is respect and compassion. If you have that, your client will teach you, your patient will teach you, but at least have that. That is what I meant by cultural safety. I have to feel safe that I'm in the care of someone who respects who I am, right? Is not going to pull off my hijab because they have to look at my head or whatever, right? Or pull off my, and all these things have happened because they want to check your heartbeat or so forth. So compassion and respect. I don't expect you to be experts on 54 cultures. I am not. I learn. But when you are making life and death decisions, this is my experience of 30 years. A person may not be practicing all their life. Time of death comes, now everything has to be by the book. So how do you mitigate that? How do you help them with that? But I can tell you, if compassion and respect is missing, no amount of good medical or other kind of care is really going to make a lasting difference or impression. Yes.
Thank you for an incredible presentation. In palliative care, we have Dignity Conserving Therapy, Harvey Chachanov's work from Winnipeg. And there's a question we can always use, and I think it's apropos to here, and it's, can you please tell me what I need to know about you to help take the best care of you?
Absolutely.
And it kind of opens the door to that respect and the dignity, and then it will come forth, and we can learn how to best take care of our individual patient.
Absolutely. And you know, the amount of people I see in anguish because they have not been able to articulate what they need and are afraid to say it. So once you ask, you've opened the door, right? And that's all we can really do. But don't look at a patient just as a patient. Look at them as a human being with human rights and human dignity. And I have learned most. I mean, I do funerals as well, and I've done hundreds of them. And I can tell you there was one family, I'm sorry I'm taking more time, just a family that, a man who lost 5 members of his family to fire. One baby survived, rarely breathing, right? I took care of them through the hospital, did everything, but the hospital kept calling, this baby is really not, has been intubated and all. He needs to let her go. And I said, please be patient. He's gone through a trauma that none of us can imagine. I cannot bring this topic up. I gave him 2 days, and the media was going crazy because it was a huge thing in Winnipeg. I then called him and I sat down with him and I said, you just sit here by the baby. And I started reading a chapter of the Quran called Surah Yasin, right? And of course, it's a baby, it's a pure, it's going to heaven. And then I said to him, do you feel ready? Are you ready to let her go? Her mother and the grandmother and 3 sisters have already gone. He was holding on for himself, right? And he looked at me and tears started running down his face and he said, yes, but I can't be here. Can you stay with the baby? And I said, sure. He left, went outside the room, and then the nurses came in and removed. So sometimes it's just that humanity, because sometimes when we are talking about faith, we get so into law. do's and don'ts and yes and no, and we forget that God is merciful. He knows his situation, right? There were people who were saying, oh, don't send these bodies, or he wanted to take the bodies, all of them too. And my Winnipeg is so amazing. The radio station called me and said, what do you need, Shahina? And I said, we need this much money. They raised twice that amount in one day in Winnipeg to have these families go. And you know what the religious leader in my community said? You are doing haram. They should be buried where they died. And I said, you know what? I'll deal with Allah subhanahu wa ta'ala on that, because I know he's merciful. So that's the kind of approach we need to take beyond the do's and don'ts, right? Thank you.
Thank you so much, Shahina, for such an interesting talk and practical too.